Welcome to our in-depth guide on dermal fillers, a popular cosmetic treatment designed to restore volume and smooth out wrinkles for a youthful appearance. In this video, we'll explore the science behind how fillers work, their common uses, and the multitude of benefits that they offer. We will walk you through what to expect during the procedure, how to choose a qualified practitioner, and the essential post-treatment precautions and the care tips. Additionally, we will cover potential side effects, risks involved, and debunk the many common myths and misconceptions that are surrounding fillers. So whether you're considering fillers to enhance your facial features or to correct the signs of aging, this video will equip you with all the information that you need to make an informed decision. So stay tuned for expert insights and practical advice on how to integrate fillers into your long-term skincare regimen. So what are dermal fillers and what are they made of? So dermal fillers are gel-like substances that are injected beneath the skin to restore lost volume or to smooth out lines and soften creases, to plump and provide hydration to the skin, or to enhance your facial contours. There are a variety of FDA-approved filler materials that dermatologists use. And in general, fillers are categorized based on the substances that they are made from. The most popular filler material that is used worldwide are hyaluronic acid fillers. This comes in the category of temporary fillers. Hyaluronic acid is a naturally occurring substance that is already found in your skin. But the hyaluronic acid that is used in dermal fillers is from non-animal sources, and it is made from bacterial fermentation. A cross-linking process stabilizes the hyaluronic acid, and it allows it to maintain its shape for a longer period of time in your skin, so it resists natural enzymatic breakdown in the body. Depending on the particle size and depending on the firmness of the specific hyaluronic acid used, the filler may last anywhere from 6 months to 2 years. There are many semi-permanent fillers which act as biostimulatory fillers. So in this category, we have calcium hydroxylapatite, which by the way is also US FDA approved to treat signs of facial lipoatrophy, which is severe facial sinking, which is associated with HIV disease. And the other filler in this category is poly-L-lactic acid. These fillers stimulate your dermal fibroblast into producing its own collagen. These fillers are great to treat acne scars as well. So while these fillers do show some immediate results, it can also act as a scaffold for new tissue formation. So you will continue to observe tissue volumization for the next 2 months even after the procedure. So the results last a little longer. They last from between 12 to 18 months. Permanent fillers like Articol and Artifill and liquid silicone are no longer used, not at least on the facial areas, because they're very unforgiving. They cannot easily be removed or dissolved or rectified. And they're more likely to cause lasting side effects like migration, nodule formation, foreign body granuloma formation, etc. Collagen fillers, they require skin testing. Hypersensitivity reactions were so common, and they would only last for about 3 or 4 months. So they went out of vogue long ago. The so-called third-generation collagen fillers, which were long-lasting and that did not require skin testing, they were also withdrawn from international markets sometime in 2009. So where can these fillers be injected? What are the common and not so common indications? So fillers can be used to fill out lines and creases. So you can use it to fill out smile lines, static lines, or the creases which are there in your forehead or your crow's feet or smoker's lines or marionette lines on the lip corners. It can be used to smoothen out chin creases. You can use it to address volume loss. So they can be injected to the hollows under the eyes called the tear troughs. You can use it to address mid-face volume loss, submalar volume loss, temporal volume loss, or even in uncommon indications like to address the atrophiomorphia. You can use it to soften creases and scars. So you can use it to fill out acne scars, trauma scars, or to rejuvenate aging hands. It can also be used to plump and enhance facial features and contours. So you can use it to volumize your lip or create a more well-defined lip, or to create a more well-defined chin, or to reshape your nose, or to soften your jowl. Fillers can also be used to lift and contour. So you can use it to create high cheekbones or to create that well-defined OG curve to restore the triangle of youth. They can be used to redefine a saggy jawline and to lift a sagging mid-face. Certain dermal fillers can also be used to restore deep hydration to the skin, like literally injecting hyaluronic acid into the skin to plump out your skin. So what are the benefits of fillers over other anti-aging procedures that provide same or similar results? See, fillers are semi-invasive, in fact, almost non-invasive. It is a non-surgical option that does not require any sedation, any general anesthesia. There's no painkiller involved, no scalpel, no suturing. It can be done as an outpatient procedure as long as the treating physician has the basic medical and surgical infrastructure. So it is quite literally an instantaneous liquid facelift. Choosing a qualified practitioner cannot be overstressed. See, dermal fillers require your treating physician to not only have a thorough knowledge of facial anatomy, the danger zones of the face where filler should not go, but they should also possess a complete understanding of the various types of filler materials and each material's unique quality. Not only this, they need to possess the critical eye, the training and the experience to study and examine each face for its unique contours, to understand the patient's needs and their aspirations, and to be able to deliver the right amount of filler in the right areas to provide the best, most natural looking and most balanced results. So you need to choose a qualified and experienced dermatologist or a plastic surgeon or an oromaxillofacial surgeon or an oculoplastic surgeon, someone who's received specialized training in the art and science of dermal fillers. Do not try to get a filler consultation or a price inquiry with your doctor or worse with their staff over the phone. I mean, seriously, talk about being penny wise and pound foolish. Not only will the doctor not take you seriously, they will mentally mark you as a red flag patient even before you have registered at the practice. So what can I expect during the procedure? Well, the procedure actually begins with the consultation. So some patients just come and they tell us like, see, I don't know what I need. I just know that I want to look better. I don't want to look so tired and saggy and so unhappy looking, so stern looking. But some patients have a more critical eye. They know precisely what they don't like about their face. They know what they still like about their features, what they want to change, what they still want to retain. See, there aren't too many contraindications, but there could be budgetary constraints, of course. Problem is we often deal with unrealistic expectations. You know, like expecting one syringe, which is literally just 1 ml, that needs to fill out the smile lines also. I want it in my tear trough also. I want it in my mid-face also. Or requesting half a syringe, you fill it into my tear trough and half a syringe for my smile lines. They're both hyaluronic acid, but they're completely different types of fillers. You can't do the same in both areas. I once had a patient ask me if you can inject half the syringe for my lip and use the other half of the syringe for my daughter's lips. And then, of course, there's the classic, you know, bringing in photographs of a model or a celebrity and saying, I want this person's lips or give me that person's cheekbones and all that. See, please understand, we can only work within the framework of your natural skeleton, your facial contours. That is, of course, if you still want to look like yourself and if you still want to look natural. So time well spent in an in-office consultation will provide you also with enough understanding about what are the different types of fillers, how much will you need to adequately address your concerns. Photography is of utmost importance. The idea, at least in my practice, is not to pass it on to or show it to other people to get more work or to use it for marketing purposes. It is to record and document the work that has been done. So if you do not consent to get photographs taken, your doctor will not go ahead with the procedure. We will also expect from you full disclosure from you when it comes to your medical history, your drug history, and your allergy history. All hyaluronic acid fillers now have an anesthetic called lidocaine preloaded in it. So as we inject, your skin actually becomes more and more numb, making the procedure more comfortable. Even so, I would still use a numbing cream, especially when I'm injecting the lips or when I'm injecting the smile lines. I also use a lot of cannulas. So cannulas actually further reduces the pain and the discomfort. Some indications, like when we need to inject the mid-face, the filler has to actually be injected directly onto the bone. So those injections are associated with some discomfort. What are the side effects and risks that you need to keep in mind? The most common side effect is bruising or temporary redness and swelling at the injection sites. After a lip filler in particular, your lips may feel swollen or sore for about 3 days or so post-treatment, and it could be about 2 weeks before the swelling completely settles down. So don't get any fillers done shortly before any important social event. There could also be some lumpiness for about 2 or 3 days, which is also likely to smoothen out on its own. So do not massage or keep on manipulating it too much. In some areas, particularly the lips, either if the wrong material or filler is chosen or because of wrong placement or because too much was injected or because you're re-injecting too frequently, that can lead to filler migration outside the area of injection. Inadequate aseptic precautions can lead to infections, poor injection techniques, poor knowledge of facial anatomy or its high-risk zones can lead to very serious adverse events like blindness and tissue necrosis due to arterial and venous occlusion by the filler material. So either get your dermal fillers done by an expert or don't get it done at all. What is the post-treatment care? You can use ice packs and avoid heat from steam, sauna, or very vigorous exercise to minimize post-treatment pain and swelling for the next 2 or 3 days. You can use thrombophоб ointment or arnica in case you have some bruising. You can use a green tinted concealer or just mix your concealer with the orange lipstick to hide any minor bruises until they fade. Your doctor will massage and mold the fillers after the injection, so you avoid over-massaging or manipulation of the treated area once you get home. What about the results and the longevity? See, results of almost all fillers are almost instantaneous and they are there for you to see literally on table. So most fillers can last anywhere from 6 months to 2 years, depending on what filler was used and which area or what was the indication that was treated. Lip fillers seem to fade away the fastest. See, although they actually stay for about 9 months to a year, if you got your lips injected for the first time, you might feel that you need to get them done in just about 6 months, or within 3 or 4 months, you feel like most of it is going away. Mid-face volumizing fillers may last up to about 2 years or so. The fact that these fillers are temporary is actually seen as a boon, because if you're not thrilled with the results, then you're not stuck with it. And if you absolutely hate it, you can get them dissolved using an enzyme called hyaluronidase. That will dissolve that filler right away in about 7 to 10 days. If you have a high basal metabolic rate from an active or sporty lifestyle, or that includes strength training, then you might feel that your fillers are wearing out a bit sooner. There are lots of myths and misconceptions regarding fillers, that fillers are only for an older aging phase. The fact is, fillers are often the young people who come for fillers, especially when they are doing it for the lips or nose or chin or the tear trough. See, fillers are not just for aging, but they're for contouring as well. Myth: it won't look natural. Fact: if the right amount is placed at the right spot, it will look perfectly natural. Myth: it won't work and I won't be able to tell the difference. See, for an aging phase, a small amount of filler is not going to make a big difference. So if you're on a very tight budget, focus on a small area rather than getting a small amount of filler done to a very large part of the face. Myth: oh, filler is going to take too much maintenance. Quite frankly, your hair color and your nail extensions that you do at the salon is going to take much more time, more money and more maintenance than the fillers that you need to do only once in a year. To conclude, injectable fillers often offer the promise of non-surgical facial rejuvenation with minimum risk and minimum discomfort. For so many indications, the results that you can achieve with a dermal filler cannot be matched by any other procedural intervention. So a well-informed patient and an experienced injector can be a match made in anti-aging heaven.